Hey there. So, the book I decided to read for this semester is Deep Medicine: How Artificial Intelligence Can Make Healthcare Human Again. So, three of the biggest takeaways that I got from this book, they're pretty diverse, but I think these three kind of relate to the central theme of the book itself. So, first, AI's purpose is not to replace a profession or dictate a decision. Rather, it's to be used as a guide to help physicians and clinicians alike make the smartest possible choice that adds the most value to the patient. The second takeaway I got is that the best outcomes are achieved through collaboration between artificial intelligence and physicians. And then the final takeaway, and arguably, in my opinion, the biggest takeaway, is that there needs to be a systemic shift from shallow medicine to deep medicine, meaning that physicians and doctors alike have to spend more time with the patient, get to know them, develop a relationship. And I think that's the biggest difference between shallow medicine and deep medicine. When it comes to taking what I've learned from the class, I think back to a few chapters, but in particular, the first one being is continuous improvement. I think what I've learned about evidence-based information, artificial intelligence can make a big impact in that area, as it has the ability to determine all of these factors that the human brain can't, analyze itself. So artificial intelligence helps improve evidence-based information. It also can improve patient safety, and it'll improve the accuracy of diagnostics, treatment plans, individualization plans, so on and so forth. And then, another chapter I thought about was clinical excellence. So, what I've learned throughout that chapter is that all these things are so important to the success of the patient. And I think artificial intelligence has the ability to not only improve diagnostic accuracy and identify things that even experienced physicians wouldn't see. It also helps individualize patient care. So, it helps us focus more on the patient itself, not the problem that the patient presents with. And it also artificial intelligence can improve the engagement between doctors and patients. It'll also help improve collaboration between patient care teams, which will ultimately benefit the patient and their continuum of care. The final chapter that I thought played a big role with what I've learned is, a lot of things that we see in healthcare are knowledge based, and artificial intelligence can help reduce variation in clinical performance, meaning that there's less adverse outcomes and the patients are safer. It can also help us standardize or universalize electronic health records, because it can dictate what the patient says, so that instead of typing down all these answers, the doctors can simply focus on the patient. And then I would also use the knowledge that I have now of artificial intelligence to achieve the mission of a healthcare organization, which is ultimately the patient and the patient's satisfaction and safety. So, in conclusion, I think that while Dr. Topor's book, Deep Medicine, points to the future, its essence is entrenched in compassion and patient care. This book was an amazing read, and it was by far one of my favorite. I highly recommend it to those who are interested in learning how to help make healthcare human again, while also understanding the impact that artificial intelligence can have on um, healthcare as a whole.